أصحاب الطريقات حق القلبات تسمع يا مالي دن دي 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 دي. طريقات ولا تسمع الحين تي دي تي دي دي.
يعزفوا لك باعث اصلا بيجي كيف بيجي ساعه البيانو
لا تسمع الحين كبي دراك
So the first cause of hypoxia is ischemia. So what do we mean by ischemia? Ischemia means reduced blood flow. It can be arterial blood flow or it can be venous blood flow. Both can cause ischemia. Let me give you some example. Say for example a patient developed coronary atherosclerosis. That means atherosclerosis of his coronary artery, the artery that supplies to the muscles of the heart. Okay, then what will happen? Atherosclerosis will make the lumen of the coronary blood vessel narrow. So now there will be reduced arterial blood flow through that coronary artery, and that will result in something called ischemia. So that is easy to understand. But now you may be asking, then why does decreased venous blood flow can cause hypoxia? To explain that, I have to draw an image. Okay, so if you recall your anatomy or physiology lectures, you know how blood flows, you know. If I draw a simple diagram, you will see, say for example, this is an artery, then blood goes from artery to capillary, right? And then from capillary, what happens? Here gas exchange occurs, nutrient exchange occurs, and then the products of metabolism and other toxic substance that are not needed for that cell, they go through the venous system. Okay, so this one is the artery. I'm drawing A. This is the capillary, and this is the vein. Okay, so why would we have ischemia when there is decreased venous outflow? The thing is, if we decrease the blood flow here, that blood will accumulate here, and that will result in decrease of the arterial flow as well. So the point I'm trying to make here is, if someone has reduced venous blood flow, fresh blood will not come to those areas, and that will also result in ischemia. Okay, so that is about ischemia. The second cause of hypoxia was hypoxemia. Okay, now at the end we have mia. That means here hypoxemia means reduced amount of oxygen in the blood. Okay, so what is that? To understand hypoxemia, we have to know how blood is oxygenated. Okay, so let's draw another simple diagram. Say for example, I am drawing the lungs. Okay, this is one lung. These are the respiratory trees, you know, and at the end of those trees we have alveoli, right? So what happens when we are inspiring air, when we are taking air, oxygen is entering in our lungs. Okay, the pressure of oxygen in the inspired air is known as PiO2. Okay, so what happens when we are taking that air? That air is coming inside our lungs, and then it is going to the alveoli. The pressure in the alveoli is written P big A O2. Okay, and from the alveoli, what happens? Gas exchange occurs, and then that oxygen can go to the blood, and then that is called P small a O2, and from the blood it will go inside the RBC and bind with the hemoglobin, and we will express that thing as SaO2. Okay, so hypoxemia means this one, this P small a O2, this one is reduced. Okay, so that is hypoxemia, and that can cause hypoxia. So now you may be asking, then what are the causes of hypoxemia? What can result in reduced amount of P small a O2? Okay, the first cause of hypoxemia is decreased inspired air. You know, if it is very simple, if we reduce this thing, since this goes here and that thing goes there, so if we can reduce this thing, this entire thing will be reduced. So what are the causes when we are having reduced amount of inspired air? The most important cause is, of course, you know, high altitude. Okay, so in high altitude, the amount of oxygen in the inspired air will be less than normal. So as a result, the entire chain, P big A O2, P small a O2, all will be reduced. Okay, so that's one cause of hypoxemia. The second cause of hypoxemia is hypoventilation. Okay, say you are in a normal atmospheric pressure, there is plenty of oxygen in the air, but you have problem in your ventilation system. Say for example, there is some respiratory depression in your medulla, so you cannot use your respiratory system properly, so you are hypoventilating. Now what happens when you hypoventilate? The reason we ventilate is to get oxygen in and carbon dioxide out. So when we are doing less ventilation, carbon dioxide will accumulate. Okay, and as carbon dioxide will accumulate, and that will also result in decreased PaO2. Okay, so that is another cause of hypoxemia. There are other causes of hypoxemia, and they include ventilation defect and perfusion defect. Okay, so what do you mean by a ventilation defect? Say for example, a patient may have respiratory distress syndrome, and there is a lack of surfactant in his lungs, and that is causing collapse of the distal airways. Okay, and since his distal airways are collapsed, so surely he cannot do sufficient gas exchange. There is problem in his ventilation, and that will result in some ventilatory defect causing hypoxemia. Okay, the next cause of hypoxemia was perfusion defect. Okay, in these cases ventilation is okay, but the lung doesn't have sufficient blood supply. There may be area where we have plenty of gas, but they cannot go into the blood vessel because there is not enough blood vessel in those areas. Okay, so that is perfusion defect. So all those things can cause hypoxemia. So I am repeating the causes of hypoxemia again. The first cause was high altitude. The second cause was hypoventilation, that can be due to some medullary depression of the respiratory center. The third and fourth causes were ventilation defect and perfusion defect. So all those things can cause decreased amount of oxygen in the blood, and that can result in hypoxia. The third cause of hypoxia was decreased oxygen carrying capacity of the blood. And I'm sure you have heard the term anemia. In anemia, we're having reduced amount of hemoglobin. And always remember, hemoglobins are important because they bind with oxygen and make something known as oxyhemoglobin, and that is how oxygen are transported inside the red blood cell. So whenever we are having problem with hemoglobin, say for example the patient has anemia, then there will be reduced oxygen to the tissue. There are other causes that can cause reduced oxygen carrying capacity. Say for example, if there is increased breakdown of the red blood cell, that can happen in some hemolytic disease, that can also result in decreased oxygen carrying capacity. And other causes include sequestration of RBC in the spleen. Okay, so these are the causes of hypoxia, and now we will discuss the mechanisms of cell injury. So what are the mechanism of cell injury? As you can see in the bottom of the board, I have drawn a series of mechanisms. All of these can cause cell injury. One mechanism is via ATP depletion. When ATP is less, it will cause a lot of effect, which we will discuss after a while. Another mechanism is via mitochondrial damage, which can cause leakage of some pro-apoptotic molecules, some molecules that promote apoptosis, and that will result in cell injury and cell death. Another mechanism of cell injury is where we're having increased